I'm Wendy Andrews, and I'm the practice manager for the Division of Hematology Oncology at the University of Arizona Cancer Center in Tucson, Arizona. I'm here to talk with you on behalf of ACCC's education program entitled the Financial Information and Learning Network for Community-Based Cancer Programs. Today, I'm speaking about insurance coverage and billing for clinical trials. This treatment option can present challenges for the cancer care team and specifically the financial counselor, but there are some strategies that I'd like to share with you in managing this issue. Are you in a state in which you have a law regarding the coverage of clinical trials for your insured patients? There are 34 states in which laws have been passed to cover clinical trials. You can go on to the internet, to the American Cancer Society website, and to find out if your state has a law and an overview of that law. This becomes the starting point to identify what your path will be in order to validate if your patient will have insurance coverage for the clinical trial and what services will be covered, which will be pointed out in your state law if you have one. If you don't have a state law dictating the coverage of clinical trials, then you will need to work with the insurance company to ask for authorization for coverage of routine services within the clinical trial. The coverage will vary by different insurances. Medicare has a national coverage decision from 2000 and updated on July 2007 that allows patients with Medicare coverage the access to participate in clinical trials. Does your study meet the necessary requirements to qualify for a clinical trial? There are 3 requirements that must be met in order for the clinical trial to be qualified. The study must investigate an item or service that is in a Medicare benefit category. The study must enroll patients with diagnosed diseases, and the study must have therapeutic intent, meaning it must not be designed solely to test the safety and toxicity of the investigational item or service. There are also 7 desirable characteristics for qualifying a clinical trial, and they are: principal purpose is to test whether the intervention potentially improves the participants' health outcomes. The trial is well supported by scientific and medical information or is intended to clarify or establish the health outcomes of interventions already in common use. The trial does not unjustifiably duplicate existing studies. The trial design is appropriate to answer the research question. The trial is sponsored by a credible organization or individual capable of executing the proposed trial successfully. The trial is compliant with federal regulations relating to the protection of human subjects, and the trial is conducted according to the appropriate standards of scientific integrity. Medicare does not allow investigators to self-certify that the 7 desirable characteristics are present, but they do have a list of the types of trials that Medicare considers to always have these desirable characteristics. Here are 7 procedures that would help you manage your clinical trials. 1. You need to put mechanisms in place to distinguish if payment policies are different among payers in the same clinical trial. 2. Require coverage analysis that determine billability of trial-related items and services prior to the services being done. 3. Establish safeguards to ensure that claims are directed to the correct place for reimbursement, such as Medicare versus Medicare Advantage or insurance versus sponsor. 4. Establish the process to apply required codes and modifiers to the services and items that are routine in the clinical trial, along with the communication tools to allow services that you order, whether within your health system or outside of it, to be identified as part of the clinical trial. 5. Develop an education program for investigators, study coordinators, billing staff, and other necessary people to understand your processes for billing clinical trials. 6. Create the process to identify the patient's financial responsibility for being part of the clinical trial and the communication method in which it will be delivered to the patient. 7. Develop an auditing and monitoring process program that samples billing for services during the research study to make sure the process worked the way you intended it to. Determining the billability of services to be performed during the clinical trial and identifying them as investigational or routine services should be done before a patient starts on the clinical trial. It is very important to determine which category each service you perform or order falls under, as the billing is different for investigational versus routine. Medicare covers the routine costs of qualifying clinical trials, as well as reasonable and necessary items and services used to diagnose and treat complications arising from participation in all clinical trials. All other Medicare rules apply such that if something is excluded from being covered by Medicare, it will also be excluded in the clinical trial. Medicare defines routine costs as conventional care, items or services that are otherwise generally available to Medicare beneficiaries as covered benefits. Services to detect or prevent treatment complications for patient safety arising from the provision of an investigational drug. Items or services required for the administration of the investigational item or service, such as infusion supplies, etc. Routine costs do not include the investigational item or service, whatever is being studied, unless the investigational item or service would be covered outside a clinical trial. This is where you need to be careful with patients that are put on a clinical trial and are receiving an FDA-approved drug along with an investigational drug. If the FDA-approved drug is not covered for the patient's diagnosis outside of the clinical trial, then it is not covered while on the clinical trial. Also, services not considered routine are those solely for the research purposes, data collection, services solely to determine trial eligibility, screening, services paid by the sponsor, and service promised free in the informed consent. You want to be really careful about how the informed consent is written in regards to what is covered by the sponsor on the clinical trial, as this is binding, and also where there have been issues with interpretation of services that will be paid for by the sponsor. Lack of coordination with services being identified as routine or investigational can result in items or services paid for by the sponsor to get billed to the insurance company, which is illegal. If the clinical trial has a calendar included in it showing when and what type of services are to be performed, you can use that to distinguish whether each of those services are investigational or routine and can communicate that information to all necessary parties. One of the more difficult areas to manage is the billing of clinical trials and remembering the rules that apply. It is very important that you have a method to know when the patient has been placed on a clinical trial and when they are removed from a clinical trial in order to report the billing correctly. Billing for clinical trials can be tricky. Medicare has developed very specific guidelines to follow when billing a Medicare patient. If a patient is on a Medicare Advantage plan, you are required to bill traditional Medicare for any services related to the clinical trial. This can cause many issues with your electronic systems. You want to make sure you work with your IT staff to create the ability to stop the billing from going to the patient's Medicare Advantage plan. One way to deal with this might be to place a hold bill on any patient that has been identified as being on a clinical trial in order to review all services prior to them being billed. If you don't have the ability to identify the patient this way and place a hold on the billing, you might consider using the diagnosis code V70.7 as a way to hold the billing in order to make the changes to the insurance information to bill traditional Medicare. CMS has also instructed the Medicare Advantage plans that they will need to make any additional payments to the patient for the difference of what traditional Medicare pays for the clinical trial services versus what the Medicare Advantage plan would pay for those services, so the patient doesn't have to pay any more than what they would have had to pay if the claim had been processed by the Medicare Advantage plan. The ICD-9 code necessary to bill for a clinical trial is V70.7, Examination of Participant in a Clinical Trial. Since what we do is therapeutic and not a control group volunteers, we are to place that code in a secondary position in order to identify the patient is on a clinical trial. There are also modifiers required on every service that is billed when it pertains to the clinical trial, whether it is investigational or routine. When identifying an investigational service, you need to add the modifier Q0. This will allow the claims processing system to identify this and proceed with adjudicating the claim. To identify the routine services, you need to add the modifier Q1. The modifier should be appended to all services that are being requested by the clinical trial. That is why it is extremely important to identify the differences between investigational and routine, and to communicate the information to everyone that will be providing the services for the clinical trial so they can be billed appropriately. Medicare has also added some additional billing information to be placed on the claims, but has also instructed contractors that they are to pay the claims with or without the additional information. For institutional claims, also known provider-based, you are to add the value code D4 and place the 8-digit clinical trial number, which can be found at clinicaltrials.gov, in the box next to the value code. You are also to place the number 30 in the condition code box. For institutional claims, the modifiers are only needed on the outpatient claims, as inpatient is paid by a DRG. For professional claims, also known as freestanding, you are to place the 8-digit clinical trial number in box 19 of the CMS 1500 form when sending electronically, and if you are filing on a paper claim, you need to add the letters CT in front of the 8-digit clinical trial number. Create an education program with tools and training slides to help staff become informed of your clinical trials process and billing procedures. These can also be used as communication tools that can be shared with those outside of your health system or office. This will allow those who are unfamiliar with how a clinical trial works to become familiar with the process, how they might fit into the process, and help inform them as to what they will be required to do in order to bill their services. It is very helpful to require all staff to go through training of these tools and document that they have received the training. For services that will be performed outside of your system, the tools can be used to identify whether the service is investigational or routine and who they need to bill. It can also help them with the requirements of informing the patient of their out-of-pocket costs. Work with your financial staff to develop a worksheet that lists the investigational and routine services that will be performed throughout the clinical trials process. This sheet should allow the financial counselor to place the patient's out-of-pocket costs next to the item of service, indicating what the patient's responsibility will be. These costs could be different for each patient on the same trial and is dependent on their insurance and diagnosis. It is reasonable to have the patient sign this form indicating they have been told of their financial responsibility. This will help with any vague information in the consent form showing the patient has been notified of what category each service falls into. One of the most important pieces to all of this is to put together auditing and monitoring components to your process. This will allow you to make sure the process you have put together works and you are compliant with all regulations for billing clinical trials. Utilize the tools that you created for deciphering investigational versus routine care costs to match with the billing that went on the claim. Monitor this more frequent at the beginning of developing the whole process, and then move to a longer time frame once you've identified your process is working the way you intended for it to work. I believe it is always important to spot check at least one patient on each clinical trial in case something unique is being done with that trial. In closing, I would say that the key points are identifying if your state has a clinical trials law in order to have a starting place. Follow the 7 steps for the process, which are payer differences, billability, safeguard for claims, required codes and modifiers, education and communication, patient financial responsibility, and auditing and monitoring. I hope that the information I've provided today has been helpful for you. If you have specific questions, please feel free to post them on the ACCC Financial Forum on my network, and either I or another ACCC member will respond to you. For more information and resources developed as part of the ACCC's education project, the Financial Information and Learning Network in the Community-Based Cancer Program, please visit the website listed on the screen.